Thank you. Doctors at Intermountain Medical Center are celebrating a first here, a heart and a liver transplant in the same patient during one operation.
News specialist Sam Penrod is at the hospital tonight. Sam, this is a big deal. How's the patient doing now?
Well, Deanie and Mike, he's doing remarkably well considering what he's been through. This is the first heart and liver transplant in Utah. The patient, he's just 31 years old. He has a genetic disorder, and you won't believe this, but he's had 18 heart attacks in just the past 9 years. But 5 weeks after this surgery, he has hope for a normal life.
I just never knew what to expect. Just always the thought of sudden cardiac death.
Life has changed for Mike Mader. Once fearing every day could be his last, his future is bright after undergoing a history-making surgery for Utah.
He looks terrific. I mean, if you passed him in the street, you wouldn't know he had a transplant. When we walked in this morning, we did a little double take because he looked so good.
On April 23rd, Mader received a new heart and a new liver during the same operation.
To do two complicated procedures and then try to put them together into one large complicated procedure, I can't tell you the amount of hours that went into the planning of this.
Mike suffered from familial hypercholesterolemia, a condition that runs in his family which prevented his liver from processing cholesterol.
The way that it affected his heart is that because he couldn't clear the cholesterol from his body, that led to blockages in the arteries around his heart or coronary disease. And so he started suffering heart attacks at a very young age. And to give you an idea of how severe it was, we would always say, if you don't mind, he had more stents in his heart than his age and years.
Since the surgery, Mike's cholesterol levels are now considered normal. And after waiting 3 years for a compatible heart and liver, Mader says he will live the rest of his life thankful for the medical team and his donor.
I'm just extremely grateful. It's the best gift that anybody could receive, and it's kind of mixed emotions. I feel bad for the family, that they had to go through a tragedy, but I just can't thank them enough. It's just amazing. I mean, it saved my life.
Well, as Michael recovers, he will be able to do more physically exerting activities, a lot of the simple things in life that we do every day. And also, this successful transplant will allow for more of them in the future here at Intermountain Medical Center. Reporting live from Murray, Sam Penrod, KSL5 News.
Good for him. Great for those doctors, too. Hey, what can 100 days of